Welcome to Taking Charge of My Cancer podcast, episode 27. I am Derly Muñoz, your host, and I have a pleasure to have an amazing surgeon here with me, Dr. Christiana Shaw. So Dr. Shaw is a professor of the Division of General Surgery at UF College of Medicine, who focuses her clinical efforts in surgical oncology. A fifth-generation Floridian, Dr. Shaw was born in Florida and grew up in the Gulf Coast. She attended the Florida State University for undergrad education at the University of Miami for medical school prior to completing a general surgery residency at Tufts University in Boston. And then she completed a surgical oncology fellowship prior to start at the University of Florida. She is an expert in surgical removal of cancers, focused on skin cancers and sarcoma, and cancer of the connective tissue. With additional training dedicated to the complex care of the cancer patient, she is well-versed in the latest surgery and treatment options. Her expertise includes surgical solutions for skin cancer, including melanoma, Merkel cell carcinoma, adrenal carcinoma, squamous cell carcinoma, and basal cell carcinoma, as well as sarcoma. She offers sensitivity, compassion, and a high level of care to her patients and welcomes the challenge to provide cures from the most complex cases. So I have a pleasure to be working with her since I started doing oncology here in the last 14 years. And I've been amazed with, how great she is with patients. Not only that, but, her surgeries are just amazing. So thank you, Dr. Shaw, for being with us today.
Thank you so much, and thank you for the warm and welcome and introduction. I look forward to speaking with you today.
Excellent. So you want to tell us about your mission? How do you end up being a physician and doing cancer oncology?
So, my path, I teach students and I tell them, you can look at my email signature. You have this beautiful introduction and it says all of these things that I am, and it doesn't tell anything about the road, about how I got there. And I think that it's really funny to look, to hear that and think, gosh, that she sounds really amazing. Who is this lady who you just introduced? And then I realized that it's me. And I think back on my story, and so I went to high school, and I had these dreams of going to Duke University, and I loved Duke University, and I was all over it, and I couldn't wait to go. And I applied and got in early admission, and I couldn't make the financial aid work. It was just too expensive. And so my family sort of said, my dad went to state school, and why don't I try to go to state school and see how that was. And I went to Florida State, and it was absolutely the best place for me. I had a lot of fun. I learned a lot. I was in band and played music and met all kinds of different people from different backgrounds. And it was really just a wonderful place to be. And then I got through I had 9 different majors in college. And the one thing that I didn't try was biology, because I have no interest in science. So of course, that's what my mother always said, that I should go into science. So I took the entire biology core, my one semester of my junior year, and finally was like, oh my gosh, this is home. I finally found it. And then I realized that sort of after I finished with a biology degree, I could either teach biology or I could go to medical school. And those were kind of my 2 options. And so I applied for medical school, and I didn't get in. And I was waitlisted at the University of Miami. And so I planned on going down and getting a research job and doing something, for a year and reapplying. And 8 days before school started, they said, hey, what are you doing next week? They gave me a call and said, we have a spot for you if you want to start next week. And everything was already going to Miami. All my little 1-bedroom apartment I had already rented, and I'd already planned for all this. And I, cried on the phone and said, I'll be there. And finished, had a great time in medical school. Miami is a wonderful place for medicine and people interested in surgery, because you have all these different clinical opportunities. You see things that you never would see anywhere else because of the breadth of disease processes and whatnot that people have. And so I was finishing at Miami, and it was match time, and I wanted to do surgery with everything that I was, and surgery was it for me. And so I applied in surgery, and when match day came, I didn't match. So I didn't have a spot for surgery. And my friends and I sent applications all over the country, and I got a 1-year spot at Boston University. And so I was one of the preliminary residents at Boston University, and I worked and I worked and I worked and I worked and I worked. And when a job came open down the street at Tufts University that January or February, I was the first name that came up when they said, who needs to have this job? Everyone said me. And so I started in at Tufts, and I finished my residency, and I got to my 4th or 5th year, and surgical oncology was absolutely what I loved. I loved the patients, I loved the operations, I loved the long-term care that you have with people. And so I applied in surgical oncology, and I didn't match. And so the next day there were 4 spots open across the country. And I think the program directors must have met and said, hey, who is out there that didn't get a spot, who should have? And the next morning, I felt like the first pick in the second round of the draft, because everyone was calling my phone and saying, oh, please, come here, take a look, see what you think. And I ended up going to Fox Chase Cancer Center in Philadelphia, which is this amazing, tiny little NCI cancer center where you learned cancer treatment from the head to the toes. So everything in between. And it really, transformed my practice and who I am as a clinician. And then I finished up at Fox Chase, and I said, you know what, I really would like to be at an academic institution in Florida. And so there were no jobs open. There were 2 jobs in the country at that time. And for the first time ever in my career that anything ever went right, or at least according to my plan, I got a call from the University of Florida, and I started here 13 years ago. Almost to the day. I think tomorrow is my date that I started. But
oh, wow. Happy anniversary.
Thanks. So my path is absolutely not what I expected it to be, or the way that I thought that it would be. And you don't see that story when you have this introduction of sort of where I am. And I think that a lot of people, I tell my students that, and you talk to your patients about that things don't necessarily go the plan is not what plan that you expect it to be. But that doesn't mean that it's the wrong plan. It just means that that's not how things are going to happen, and you have to work through it. So as far as, how I got to cancer surgery, I loved operating everywhere. I liked how different it is. I liked how there's no place in any book that I can read how to take out a certain person's cancer, because they're all different. They're all growing somewhere, and they're in a different location. They have, different considerations. They have different, other medical history. This one is attached to the colon, and this one is coming from the small intestine or the abdominal wall. And so having to create something based off of different operations every day, I find really, really interesting. And I like that it's one of the few places in surgery where you have a long-term relationship, where you follow people. I have patients I followed for years.
Yeah.
And being able to come in and say, oh, hey, how are your kids? Or it's so nice that your granddaughter is going to PA school. That, it's so exciting. I love being part of their lives throughout the time that I get to care for them. And the surgeries are really fun surgeries. You have a mix of things that are small and things that are bigger surgeries. So it's stimulating to think about every single day and what you do that's different.
Yeah, and then your path is not finished that, because you used to be here all the time doing surgery, and now not anymore. So you are now, like, correct me if I'm wrong, but you can just tell us, like, the director or something with the medical school, right?
Right. So a portion of my time is dedicated to medical student teaching. So I'm the clerkship director for surgery. So I oversee the education of all 150 or so students that come through for the year, and am responsible for making sure they have a good education and for their grades, and really thinking about, how do I teach somebody who's going into psychiatry or neurology things that are relevant to them and their practice. How do I teach a pediatrician how to talk to a pediatric surgeon? How do I teach a neurologist how to talk to a surgical oncologist? Or, we have different communication throughout the day with different colleagues. How do I talk to what do I know about physical therapy, and how do I talk to my physical therapist? Or, and, tell patients what to expect, or how they can benefit from this.
Okay.
So I do a lot of teaching, and I've always found that interesting. That was part of why I went into academics, was to teach students, but also to teach residents, so the surgeons of the future, when it comes to things like melanoma, or something that could be a more simple, thought of as being technically simple. It might be the 2000th or 3000th time that I've done that operation. But for them, it might be the first time they've done it, and being able to, or the 10th time they've done it. And I might be able to impart some wisdom on how to proceed through the operation, or how to think about setting up your operating room, or where the lights go, or where to put your retractors, or how to use your assistants, or how to communicate with your team. And that I always find really interesting, because everybody has something, even me, to learn when it comes to those sorts of things.
Well, they have a great wisdom, I can tell you that. So you're amazing. So how about, would you give us 3 valuable tips that you learned about your journey, which has been a very long journey?
So, it doesn't go as planned. You have to have resilience through this. A few years ago, I had finally sort of reached this nice, comfortable point in my career, and I had an injury that led to a corneal ulcer. And so I'm 10 years into my career, and I'm supposed to sort of be right at the point of where I'm most productive, and I'm really at the top of my technical game, and I lost vision in my right eye overnight.
Oh, wow.
And so I went through a whole bunch of treatment for months, and ended up 6 months later with a corneal transplant. And so even though I had made it all the way, past all of my education, right turns and left turns, there were still things personally that I went through that I wasn't expecting. And to be able to come back from that resilience, and have the support of my family, and the support of my colleagues, who were amazing, and to have a wonderful surgeon myself, I have expert sutures in my eyes because of her. That your willingness to be able to adapt to change. My practice changed, and my life changed a lot. So that being the resilience and adaptability to change, I think has been my story, professionally, certainly, and personally as well. So.
Wow, well, thank you for sharing that. Yeah, it's funny how you just hear things, right? And I remember one time, we were in tumor board, and you mentioned something like, I'm just something with my eye. You excuse yourself, on the phone, like, we'll talk about this patient, but I gotta go. And I never knew that was just running down to this. So I'm glad that you come back out of that. That's amazing.
I came back out of that. My corneal transplant was February 2020. And so then I was going to hit the ground running, and I was ready to go back in and get back in, and then the world stopped. And
yeah.
So then we had to all adapt to things that were different.
Exactly. That's true. Yeah. That's true. So with that, what has been your most painful lesson, you think, through your journey?
I think that every time that I got to the point where I didn't match, or I didn't graduate, or I graduated, but I didn't get to that point, it felt defeating. And it took until the next step. I think the hardest one, probably, the corneal transplant was a huge thing. I felt like I couldn't take care of myself, and I couldn't take care of my family, and I was a single mom, and so there were all these things that felt like I was failing, and it was very defeating and very challenging, and it was a lot to come back from. I think professionally, the most difficult time that I went through was when I didn't match in oncology. That night was I had gone all the way through, and I was the last time of my training, the last days of my training. And I'd gone to 4 years of college and 4 years of medical school and 5 years of surgery residency. And it was just the last step. And the last step was actually getting here, which I didn't realize at the time. You couldn't see at the time, but that one was a real challenge. That one was really difficult. And things changed the next day. I mean, I didn't have to sit with it for long. But personally, my life definitely changed with with the cornea. And I'm forever thankful to my donor and her family for being able to have a completely new start on things. I mean, to have transformed my life and to have given this back to me, to be able to take care of people, I'm overwhelmingly grateful to my organ donor. And you think of organ donors often as being a kidney or a lung or a heart or something else, and something as simple as a cornea that people don't necessarily think about as being an organ donor changed my life.
Wow.
And so being forever grateful to my donor and her family. Certainly that was life altering to have somebody give me that gift.
Great. Is anything that you have that will be of value for audience? You deal with melanomas and sarcomas, which it is bad. So what kind of tips will you give that to our audience?
Well, you don't know what's going to happen. I had a patient who said, this whole, like, people will say, oh, you saved a life or you did whatnot. And I never really understood that concept. And I had a patient who came to me on her birthday, and she gave me a birthday present. And she said, thank you for giving me this birthday, or thank you for helping me get to this birthday. And that really resonated. That all of a sudden it made sense. That I hope that I can intervene with whatever the cancer is, so that you can enjoy more birthdays. And it isn't up to me what you do with them. It is up to you what you do with those birthdays. And it's up to everybody, whether you have cancer or heart disease, or you're just living life and you don't have any medical ailments that you're aware of. It's up to you what we do, and it's up to me what we do with our birthdays, and to live life and travel and take the trip and call the friend and use the good china or whatever it is, right, to enjoy those times, because none of us have any idea what's next.
Yep.
And I think maybe instead of me teaching my patients that's what they teach me every day.
Yep.
Is to enjoy those times. So
absolutely. That's one of the things. I did orthopedics for a long time, and when I moved into the oncology world, I think that was one of the things that totally drew me to that. Like this population, they're just so grateful, and they just really, it's a completely different point how they see life. And it's like, oh my God, you end up really complaining sometimes for really small things that really, because my foot hurts right now and I'm limping a little bit, that's not a big deal. When you have somebody that you work with every day that is going through all these cancer treatments and super worry about their life and how they're going to survive, take care of their family, or just being with their family, that really changed a lot of the perspective about our own life and the little things that we complain about, right?
Perspective is the word that just resonates, right? It is. I get a daily dose of perspective, and I'm very grateful for them giving me the perspective that they have, right, for sharing that with me.
Absolutely.
Where my priorities really need to lie.
Yep. How can people find you?
You can go to the UF Health website, is the best way, and my clinical information is there. And I am not as active on socials, but those are the best way would be on the UF Health website and searching for me. My information is there.
Okay, perfect. Yeah, and I will put that in the description of the podcast as well. How about books? Is any books that you would recommend to the audience?
So I have a really busy house. My partner Brian has 3 children, and I have 2 children, and so I hadn't read a book in about, I don't know, it felt like forever. And my kids were with their dad, and Brian was off at a conference that he goes to sort of once a year. And I was by myself in my house. And in 5 days, I read 5 books.
Oh, wow.
So, and that was back in April. And I just finished another book today that was fascinating. But I loved the first book that I read was Untamed by Glennon Doyle, which was just a fun book and a sort of a reminder of, to get out there and be yourself and be who you are. And I thought that was really fun. But I also read Mindset by Carol Dweck. I read Think Again by Adam Grant. And a few years ago, probably the last book that I read was Grit by Angela Duckworth. And that all ties back into the resilience. Mindset and Think Again are very similar. And it is to think with growth. How can I learn from this? What can I do differently? Don't accept the status quo. How can we change things? How can I change my perspective? And Grit by Angela Duckworth is that, resilience, when you fall down, you have to get back up. And then, the Untamed is to be true to yourself and think about how you can make a difference in the world and who you really are. So those are my four books. But
Awesome. That's great. So what do you do for fun when you have 5 kids?
I love being out on the water. So I grew up, as you said, out on the Gulf Coast on Anna Maria Island. So that's home. And I love going home. And I have an old boat that gets me out on the water. That's older than I am.
Do you drive it?
And yes, and so I actually grew up on the water. I grew up on a boat before I could drive. And
wow, cool.
I love fishing. I love just being on the boat or being on the water. It reminds you how small you are and what a beautiful world we live in. And so I love fishing. I also love travel and exploration. I love food and eating new food and exploring different cultures. So traveling with my family or traveling with my partner, Brian, to different places all over the world and experiencing new things.
That's awesome. Have you ever been in Colombia? That's where I'm from.
I have not been to Colombia.
Oh, no. Come and visit. It's a beautiful place.
We'll have to put that on the list and I'll have to pick your brain about it.
Oh, absolutely. Absolutely. Maybe I can just go and give you a personal tour.
I love it. I love it. Even better.
Is there any question that you wish I would have asked you and will you have answered it?
No, I think that the last thing was just about family, and that I have this whole other life. And it may have been Dr. Singal, who was on your podcast on a different episode, who, we all wear lots of hats. So I have put on surgeon hat and I put on mom hat and I put on friend hat, depending on where I am and who you're with. And I think that it's important that you recognize that you have to take off that hat completely and put on the other one, because my kids recognize who, that I have this other life where I am a surgeon, but that to them I'm mom, and they really want me to wear that hat. Mm-hmm. And so the people who you are with really only care about the hat that you wear for them at that time. And so to be able to disconnect from some of the other parts of your life and be fully present when you're with people, I think is something that's a little bit different when you have a professional career that's very different from your personal life. And so to be mom when I'm able to be mom and spend that time with them and take them on my adventures and show them new things. So how important my family is, and to be able to, the part of or a huge portion of what I do is to be able to do that for them. If you look at my goals of life, it's to teach my children to be good people and to try new things and see the world as an open book and go explore.
Yeah, that's great. That's a very great advice, because sometimes we get so in tune sometimes with work that sometimes we forget that, right? So we come home and then it's like, okay, but I gotta do this and this is in our mind. And then, yeah, you're right. I think that's a great advice. I think sometimes I even forget that I gotta be putting that full hat on myself when I'm with my family, because you're thinking about all these other things that are going on. So that's
I think that was part of when I had the corneal transplant, that I was just stopped. that I couldn't, and that the hat was taken off, and
Yeah.
I had to put on a different hat and then go back and find that hat. But that there are times when it's just not possible to be certain aspects of your life that you think that define you.
Mm-hmm.
And that was the most difficult lesson from that time. But to be able to come back and practice again is really, really fulfilling.
That's awesome. Well, thank you so much for sharing that. That even made me admire you even more than I used to before I knew what happened to you. So, yeah, patients love you. Everybody speaks so highly of you. I know, you used to do more breast cancer patients as well. And we still see patients that have seen you for years and they still talking, very greatly about you and what a great surgeon you are and what a great scars. Like some scars, I don't even see it at all. So it's kind of like they always going to be very grateful for what you did to help them or do to help them all along. So thank you for being here, Dr. Shaw. I really appreciate it.
Thank you so much for having me and allowing me to share a little bit of my story and to just spend this time with you.
Awesome. Well, you have a great evening.
Thank you. You as well.